All right, wonderful. We're 1 minute and 45 seconds away from starting. I'm Reda Sadki from the Geneva Learning Foundation. I'm here with Charlotte and Boo also for the foundation, but we are not the ones who matter here. The ones who matter are the more than 300 people already in the room with us as we're getting ready. We're counting down to the second weekly assembly of the Movement for Immunization 2030. Stay with us. We'll be there in 1 minute, 20 seconds. You can see the countdown on your screen. See you soon. Wonderful to be with people from 110 countries. You'll be hearing about this movement, what we've done so far in week one, and what we're going to do in the coming weeks. Stay with us. All right, it's the final minute of countdown. You can see down to for this 14th of March, second weekly assembly for the Movement for Immunization Agenda 2030. You can already say hello to Emanuela Chinonye Odunze joining from Nigeria. Thank you so much, Emanuela. See you soon. If you're connecting, if you're watching on YouTube, wherever you may be, YouTube, Facebook, Twitter, LinkedIn, let us know you're there. We'll be sharing. We're always pleased to share the messages. And of course, many, many people in our Zoom studio, hundreds today, are joining us. See you soon. Warm welcome to you from Geneva, Switzerland. I'm Reda Sadki, and I'm here with our very own Charlotte and Boo for this second weekly assembly for the Movement for Immunization Agenda 2030. How are you feeling, Charlotte?
Feeling great, feeling excited, and just happy to be here with 337 members of the I-2030 movement, Reda, for this General Assembly.
That's just amazing. And you see, we'll be sharing the new number each week of the total number of people who are active on the Geneva Learning Foundation's platform. And you can see here, right now, as of today, it's 43,790 people. I think that's worth applauding. And this is not only about what we share with you, this is about the connections you build with each other. And before we go any further, I want to honor Asad Ali. And I don't know if he is in the room with us. Let's see if Asad is here. No, he is not here, but he wrote to us to tell us why he may not be here. Charlotte, could you do the honors? This is a message from Pakistan.
Always a pleasure, Reda. Hi, I'm presently in the mountainous region of Pakistan on a COVID-19 vaccination surveillance and monitoring mission. There is almost no internet connectivity here. We'll be back to home station on the 16th of March. Please guide regards.
All right, I hope Asad Ali will hear this message and hear that we sought to honor him and every other immunization professional who is out in the field with no internet connectivity today. Want to say hello to J.B. Bayanwu Peters from Liberia, Ayuka Charles joining from Kenya, and Yusuf Muse Alawa. Awali, please tell us where you are connecting from. All right. So second message I wanted to bring up, Charlotte, here it is. And this is from Sayed. Sayed Zai, not going to ask you to read it. He's got a single message. He says, yes, I am ready to rock. So I don't know if Sayed Zai is in the room with us. Let's find out. All right, and you can see him. We'll be sharing your messages. We do read all your messages even. Don't be mad at us if we don't reply, but we do read everything, and you can see here Syed's message is quite eloquent. I hope some of you are feeling the same way today. And then we have a third message from Surya Prakash Mishra. So let's see if Mishra is in the room. Yes. All right. Who says, I am from Victoria, Australia. And then Magaji Mega, who answers and says, good to hear. I am from Nigeria. And then some of the members of the movement who shared some love. Let me see if we can get Surya Prakash Mishra. Are you able to speak to us? You are in the room with us. Lovely to have you. Hundreds in our Zoom studio. Surya Prakash, tell us who you are, what you do in Victoria, Australia.
Hi, Reda. It's Mishra here. How are you?
Wonderful to hear your voice. How are you doing? What time is it in Victoria, Australia?
It's around just past 3 p.m.
3 p.m. Okay.
and 3 a.m.
Three.
This morning, early morning.
All right. So that's what I thought. So let's give you a round of applause. 3 a.m. We were talking with Lulu Bravo right before this session, who's connecting from the Philippines, where it is now past midnight. Surya Prakash, why in the middle of the night are you connecting to this weekly assembly for this movement for immunization? Why do you care enough to be there?
I think it's a passion for immunization and making every vaccination counted. I have been working with, not currently, but I used to work with the New Zealand Ministry of Health as a senior advisor, epidemiology with the national immunization program. And we had a very successful journey from 2007 to 2012. That five-year period to improve immunization coverage. And the success story was that moving along the path of the 5 years, we built a very sustainable immunization program, and we achieved 93.5% coverage in 2012. So I just wanted to be here with all my colleagues and just wanted to share the experience which I got from the New Zealand Ministry of Health. It's one of very successful public health program in New Zealand, which improved immunization coverage successfully. And I was also pretty much privileged and honored to work with the Department of Health in Victoria to work on monitoring and the reporting of the COVID vaccination program.
Thank you.
I was just seconded for the 8 weeks.
Wonderful, Mishra. Thank you for sharing, and we're glad, we're honored that you are bringing this experience to the Movement for Immunization Agenda 2030. And Magaji Mega, it's too bad Magaji is not in the room, but Magaji, we showed your message, and we hope you'll follow up and get to know Mishra. Now, this is part of the full learning cycle, a series of peer learning activities organized by the Geneva Learning Foundation to contribute to this movement. Thank you very much indeed, Mishra. And this is a continuum of action going from knowledge all the way to impact, as Mishra just did. When you can report back, this is what we did and this was the outcome, this is how it made a difference. And right now, as if today, more than 200 newcomers have joined this full learning cycle. So you can see 319 immunization professionals have been accepted to the full learning cycle. And you can see here, I believe this is the updated list of participants. So you can see the top 5 countries have not changed. But let me tell you, if you are the sole representative of your country in this movement right now, 2 things I'd like to tell you. First of all, you see, when you watch the Olympic Games, there are always countries that have one athlete, that are able to send one athlete. Well, you are that athlete in the movement for immunization. And the second thing I'd like to tell you is the movement is still open. A movement does not close its doors. So the movement is open, and it is in your hands to grow the number of participants from your country. I'd like to say this message, especially even to the Nigerians and the Ghanaians. If you think about how many people work in immunization in Nigeria or Ghana or Pakistan or India or Kenya, these may look like big numbers, but when you bring it back to the size of the country and the number of health professionals, it's still a tiny fraction, and it is in your hands to make that difference in the coming weeks. Now, what is the point? You may say, so what? And I want to greet Beyanwu G. Peters from Liberia, and I believe Wailing Ong always sends messages to his colleagues, or I hope I'm not mistaking the gender. So let's bring, so your colleagues can see their names if they do respond to your call. Yusuf Museawala from Ethiopia is joining, an immunization coordinator. Now, what is this about? You may say, so what? All right, so people somehow have managed to get excited about this. What difference does it make? Well, in the last 7 days, in the first 5 working days of the Ideas Engine, there are 313 ideas and practices submitted in the Ideas Engine. So I'd like to really ask you, give yourselves a round of applause. Tell yourself, even if you haven't been to the Ideas Engine yet, you're still part of this movement. And remember, there are 2 goals for last week. All right, so this is for last week. and this is for week 1. And it's in your personal space, in your personal learning dashboard. Complete all of the steps in how to get started. And second, to actually get to this famous ideas engine and share an idea or practice. And I can share right now for those of you who are in the Zoom studio, the link to get to your learning dashboard. So have you completed the tasks in your personal dashboard? If you have, I would like you to type yes in the chat in our Zoom studio. Even if you're on YouTube or Facebook, Luis Vasquez has completed his tasks. Saiduru, Patrick, Shailesh, Jacinta, Bilali, Mike, Zaid. All right, this is just, I wish I could show you this window. This is Jamilu, Melese, Gordon, Al Hassan, Chiniere, Bede, Rebecca Bello, Isha Goyal, Edem Uwa. Absolutely amazing to see this many people have completed. This is step 1, folks. So now, let me reassure you, if you have not yet gotten to your dashboard, Charlotte, what is the message?
If you have not yet gotten to your dashboard and you're facing a challenge, do not suffer in silence. We are a community, we are like a family. We are there to share your concern with you and give you the support that you need. So I'm inviting you specially on Wednesday, on Friday for the technical support session, so that there together we can sort out the issue that you're facing.
Thanks, Charlotte. So, and the second question is, again, I would like you to go to your chat. I appreciate Maureen Osembo, who actually typed from Facebook, who put in yes to let us know that she has gotten to her personal learning dashboard. Let's do the same thing again. Have you shared an idea or practice in the ideas engine? So go ahead and type yes if you have made it. And I'm going to show you, I think we can go right now to the ideas engine. And here I just have to switch over to from French to English, but you can see, all right, Luis Vasquez, Michel Alao, Henry Sudira, Shaidula, Jamilu, Gebeyu, Nuru. All right, more than 500 people in the room, and so many of you have already done it. Again, do not despair if you haven't made it yet. You have this entire week to make it. There's lots of technical support being offered. Charlotte just gave you some of the details, but I would like now to announce probably one of the best moments, one of the best experiences. Now, we know getting through these platforms is a struggle, let's be honest, okay? It's not easy. You need your login, your password, you need all these different things. Here is something that everyone can do, all right? And so if you have been active in the movement, so you haven't sent us a message saying, no, I don't want to be in part of this anymore, and you've actually done some things, well, in that case, you're going to be matched with another scholar, so someone else in the movement, and we hope that will be your twin for IA 2030. What does that mean? That means you contact them. You can contact them by any means. If you prefer WhatsApp, you don't have to use Telegram. You can use anything that works. And you are matched with one person. It could be someone from your country. It could be someone from halfway around the world. It is based on, we try to match people who've been making similar progress. All right. So if you're well ahead, you've submitted ideas in the ideas engine, you've completed, you're at 100% in your dashboard, you will probably be matched with someone with a similar profile, and we'll be able to work together. If you haven't, if you've gotten stuck, well, we hope that the person that we match you with, if they're stuck too, maybe you can talk to each other, help each other, and motivate each other to attend the technical support and other means that we have available to help you. But these are the Immunization Agenda 2030 twins. So that, look for the email. The emails will start coming, start being sent out after this assembly. And of course, you only know this because you are in the assembly, so watch for it. All active participants in the movement will be receiving this email. Now, I'd like to open the microphone. I see already 10 hands raised. I'm going to lower them all and to ask this time for volunteers who wants to answer this question, the idea or practice that you want to share or that you have shared, and what ideas are you looking for to help you with your challenge. So don't forget to introduce yourself. I see Gold, David Suberu, and Abu Bakr Labaran Mohammed. I remind you of the rule: if you are from one country and you speak the next person should be of a different gender and a different country. So let's start with Abu Bakr. Abu Bakr, a warm welcome to you.
Hello, good evening, sir.
Good evening to you. Please introduce yourself and tell us what is your challenge? What ideas are you looking for to help you with your challenge?
Yes, thank you. My name is Abubakar Labaram Muhammad. I'm a registered nurse, Nigeria, with BSc in nursing science from Sura University, Egypt. So actually, I'm one of those who run the immunization program in my hospital over here. One of my challenge and what I want to understand regarding this issue is that my challenge is how can we deal with zero dose of child, and how can we trace those child with zero tolerance to immunization in the community? Because some going to the public with tracing house to house visits to see that, yes, is this child immunized? How can we determine that this child is not immunized and this child needs to be immunized? This is the only challenge I'm facing over here. Thank you very much.
All right, thank you, Abu Bakr. So I'm going to demonstrate. Have you been to the Ideas Engine, Abu Bakr?
Yes, sir.
All right, so so if I type 0 dose in the search, and then I will see let's see if there's anything on 0 dose. And you can see right now there are 26 ideas that have been shared on 0 dose. Have you looked at these ideas, Abu Bakr? Have you been able? Yes. All right, and now let's see. I'm going to click the People tab, and let me see if all right, let's see if anyone with the name Abu Bakr has. All right, several actually. So, are you in this list, Abu Bakr?
No, I'm not in the list.
So you have not yet joined the Ideas Engine?
No, I have joined for the previous, even the Zoom. I have joined.
Yeah.
But I asked the question in written, but I don't know why I'm not among.
All right, let's find out. All right, maybe, yeah. So I have Abu Bakr Mohammed. Is that you?
Yes, same. I'm Abu Bakr Muhammad 2 years, sir. I'm the one.
Okay, so that's you. So you have made it to the Ideas Engine. Let's see if you've made any, but you have not made a submission yet. So Abu Bakr, I'd like to tell you 2 things. The first thing is, well done. Congratulations, you made it to the Ideas Engine. Second, you can now use it. You see how I click on the Discover tab over here? And then once you click on Discover, whoops.
Yes, sir.
All right, let me go maybe to the dashboard. Or once I click on Discover, I can look for 0 dose, and I can find other people's ideas. And then you can find other people's ideas. And here I go to Ideas, click on 0 dose, and I can look, for example, at Syed Zai, who sent us this wonderful message I shared in the beginning, who's actually submitted 3 ideas. And here is what Syed Zai has done about 0 dose in Afghanistan, all right, in challenging circumstances. So perhaps you can look at his ideas or practices and the ideas and practices of others shared in the Ideas Engine and make progress yourself. Abu Bakr, I would like to ask you, you are part of this movement. You have made it this far. Can I count on you to keep going and get to the point where I can go to the Ideas Engine tomorrow and find your contribution?
Okay, thank you very much, sir. I'm very grateful, sir.
All right, wonderful. Thank you. Abu Bakr, let's keep going now. For those of you who have poor connectivity, and I see 13 hands raised, and I will share with you, I'll show you how you can share, even if you do not get to speak in today's assembly. You can still share your testimonial, respond to the questions. You can also do it in the chat. It used to be there are always scholars who would be responding to questions in the chat. Don't just say hello. Now, if you have poor connectivity, going to share with you the 568 people in the room. That's just amazing. If you haven't subscribed yet to the podcast and you have poor connectivity, this is a great way to get it's like listening to the radio but on demand. So that is what matters. And for those of you who need help, there are 2 sessions you can see here, sharing experience and the technical support. Check your emails. Just go through your emails. You will find the links if Charlotte is not able to share them right away. And we also know that many of you are doing just fine. So you'll be receiving an email right after this session, and it's got a green button saying, yes, I am active in the movement. It takes a few seconds. Remember, it's not like the application. So it just takes a few seconds. You all took the application to show, and that was step 1 to showing your willingness to commit to the movement. You answered over 95 questions. Allow me to reassure you, we will not do this to you again. This is a quick questionnaire. We ask you, how are you doing? And you get to tell us, I'm doing fine. I have a problem and need help. I want to share my experience. This is also where you can tell us if you want to opt out of the movement. So we asked you last Monday, 1 week ago, if how you were doing, and here is the answer. All right, you can see more than 1,400 people responded. 92.7% of those who responded said, I'm doing fine in the movement. Take a second or two to appreciate that. 1,400 people from all these countries who came together and who said, I'm doing fine. Now, for the 90 of you who said, I have a problem and need help, for those of you, that is what the technical support sessions are for. You need to come, though. We cannot do it for you. You need to come. We will help you. Last week, we had every session. We had dozens of people who were actually managing to connect to the Ideas Engine, to get to their personal dashboard, and to begin to work in the movement. Now, the most amazing thing, as I said, is 313 ideas and practices already submitted to the Ideas Engine. And I want to take a minute, whether or not your country is on this board, please give a round of applause. 60 ideas from Nigeria, 41 from the DRC, the Democratic Republic of the Congo, 25 from Ghana, 17 from Ivory Coast. It does not matter. You see, the size of the country is not everything. Guinea, India, Pakistan, Cameroon, Kenya, Mali. If you're not happy with where your country is in the ranking, it is in your hands to go to the Ideas Engine and make that difference. We're going to go quickly now. Afghanistan, to honor the folks who have been contributing, so you can see their names here. This is our honor roll. You can see here we have Argentina, Maria Fernanda Monzon, who's contributed. Bangladesh, I'm not going to read all the names, but I do want to read a few and honor all of you who've taken the time to share with your colleagues. You could keep your ideas and practices to yourself, and you chose to take the time, figure out how to log in. Despite your busy schedules, you did it. That is something worth celebrating. I want to emphasize that. Whether you are from Bangladesh, from Benin, you see we mixed both francophones and anglophones in here. From Bhutan, with Mimi Manak, Botswana, Burkina Faso, Burundi, Cameroon, Central African Republic. You can see, I hope you are proud to see your names here as someone who's contributed, who's made a contribution to the movement for Immunization Agenda 2030. This is step 1. The following steps will be about execution. Having ideas is wonderful, but you need to do something with these ideas, and that's what we'll be starting on Monday, the 21st of March. From the Congo, from the DRC, East Timor, Timor-Leste, Ethiopia, with 4 contributions, Gabon, Gambia, only one contribution. Be proud of that one contribution. Georgia, Ghana, Guinea, Haiti, India, Ivory Coast, Kenya, Madagascar, Mali, Myanmar, Niger, Nigeria with 60 contributions, PNG, Papua New Guinea, Rwanda, Senegal, Sierra Leone, Solomon Islands, Somalia, South Africa, South Sudan, Switzerland, Tanzania, Togo, Uganda, United Arab Emirates, and Zimbabwe. You can see this is an international full learning cycle. And we will get to questions like Danjuma Abdu, who says, how do we tackle defaulting? Mohamed Quresh from Ethiopia perhaps has an idea on how to do that, so that's what we'll be looking at. Ahmad Sanga, connecting from Kaduna State, a warm welcome to you. Now, I want to mark a pause here to quickly go through, before we get to the best part of this. This is where we turn it over to you. You'll be telling us about your ideas and challenges. I want to turn here to go to François Gass. François, you are our guide on the side in this endeavor. Twice a week, you connect with participants during the experience sharing sessions, and you bring your experience. You bring also your expertise, as does every participant. And we put on our thinking hats and work on these challenges. When you see these results, that it just in the first 5 days, really 5 working days at least, we have over 300 ideas that have been shared. What are your thoughts? How do we go from ideas to action to result?
Hello, everyone. Hello, Reda, Charlotte, and everyone. I'm really happy to be with you and delighted to see that so many participants, scholars wants to share their ideas to address a challenge and share with peers that we may be able to use those ideas in their own context with some adaptation to make a difference. So bravo for sharing your experience, your ideas, because it's extremely important. I think going together will make a huge difference. When you're alone with your problem in a district, in a health facility, or in a region, it's always so important to go together and to try to see what would help resolve the problem. And those ideas will come along. Some may not be good for your context, but some be very good. Now, the next step is really to be sure that person who share ideas, and maybe you will be in connection with people who want to use your idea, are very specific in the way they make the idea work. This is extremely important for everybody. So I'm looking forward to be in the next all this global event on the Mondays, and to be twice a week with Charlotte to discuss, to understand better your ideas and make sure that those ideas will be executed in the future. And looking forward to learn even more, because we learn each time. Thank you, Reda. Over to you.
Thank you very much, François Gass, our guide on the side for these. Now, I want to show you, Professor Becky Tagbo has just sent a message. I salute the commitment of all learners connected from close to midnight to early morning local time. This clap is for you. It shows the strong motivation that immunization professionals have across the globe. We have participants here for whom it is after midnight or in the middle of the night, 3 o'clock in the morning for some of you. Thank you. Now, in fact, we asked you, how is this helping you? What is the point? So what? All right. What's the point of these sessions? How is being part of a global movement helping you? Now, before we get into that, Jamilo Bebeji sends a message. How do we involve policymakers, more especially local traditional institutions, to support the campaign on immunization to their teeming population? Jamilu, that is a great question for the experience sharing session. I hope you have the details. If not, we'll share them with you. Stay with us. Keep listening. We'll be sharing these in a little bit. We asked you, has participation changed you as a professional? And you can see just a strongly agree. That's 473 people out of, I think, 1,400 who said they strongly agree with that. And this is just week 1. What does that actually look like? Charlotte is going to tell us by reading this quote.
Participation enables me to share ideas and also learn from other professionals globally. This enables me to know what I don't know and also get stronger understanding of what I already know. It also enables me to acquire new skills and experience, which helps me to make positive change in my profession.
All right. We also asked you, has this affected your social connections? And you can see once again, this may be a little bit less obvious, especially in the first week, but this person said, I thought I am alone in my challenges and that my country is the only one not doing well in immunization, but I am not alone. that realization, that is what we are hoping for. That is why we need a movement. That is one of the many reasons. Now, we also asked, has participation helped my professional practice? And we'll be sharing the full slide deck. You'll see the testimonials we've received. Just absolutely amazing how people are already experiencing something positive from having joined this movement. Charlotte.
Participation improved my listening skills. It made me start to listen more and learn from others, which is a good thing.
We asked you, has this changed your ability to influence the world? These are things that matter if you're a professional. And you can see very, very large numbers, 4s, 5s, and 6s. And Charlotte is going to tell us, yes.
Every little good practice and knowledge I gain in this forum goes a long way to impacting positively on my practice.
You took the time to answer these questions, and so many of you gave great comments. We had to dedicate some time today to this. We asked you if participation, and this is just week 1, has helped you see the world differently. And again, lots of 4s, 5s, and 6s. Here is a longer quote that Charlotte is going to read like poetry.
Participation changed the way I look at things and how my challenges can be instead used for service delivery, and also understanding that when you share challenges, there are people out there willing to assist you to overcome these challenges. Therefore, it's just amazing that I joined this movement, and I believe that I will be sorted in anything that challenges me.
There you go. That's what you told us. A few quotes. We actually want to turn to those of you who are in the room. I'm going to lower everyone's hands for a little bit. Now, if you'd like to answer this question, you can put your hand back up, especially if you have never spoken before, especially if you're from a country we have not heard from before. What has changed for you after 1 week of the movement? Let's go to Agre Hiera. Agre Hiera, we would love to hear from you. Yes, please do introduce yourself and tell us what is different for you after just 1 week in this movement for Immunization Agenda 2030.
Thank you very much. Hi, everyone. I'm Agri Hiera, Environmental Health Officer, and also a Town Immunization and Vaccine Officer from Tarime Town Council in Tanzania. Within this 1 week of our movement, I've learned a lot of just sharing ideas with others through the pages that have been created, and also I've learned a lot because I took a lot of my time to read other challenges that others are facing and what they have done to overcome their challenge.
All right. Thank you very much indeed. Agree. Yes. And how does that help you to do that, to hear about how other people overcome their challenges?
Yeah. By listening the challenge that others are facing and also comparing to what I face in my work, it helps me to sort out my priorities and how I can tackle those challenges, and also add some more ideas, learning from others what they have been done. So I put those ideas and put into my work so that it can help me to increase the uptake of vaccine in my area.
All right, wonderful. Thank you so much, Agre Hiera. And is this the first time you are participating in a movement for immunization?
I was last week, but for contributing, giving up my ideas, what I've been learned, this is the first time for me to speak.
All right, wonderful. Let's offer a round of applause. And as we dive into the work, we'll be doing less applause and more talking about how we are executing on these ideas, how we are taking action on these ideas, how we are analyzing the situations. But right now, it is well-deserved to take a little bit of time to celebrate. Thank you, Agre Hiera from Tanzania. Charlotte, who shall we hear from next?
Thanks so much.
I'm going to invite Faisal Ahmad. Faisal was second to raise their hand.
All right. All right, Faisal.
Faisal
Ahmad, please unmute yourself.
Okay.
All right. Otherwise, let's go to Boma Otobo. All right, Faisal. Yes, we. Faisal, I am so
Unfortunately,
sorry.
Faisal, we can't. Yeah.
Yes, I'm so sorry, Faisal. Please type your message in the chat. And for all those of you who have your hands raised, we're not going to be able to get to everyone. So we want to, so please type your message, type your response. What has changed for you after 1 week? Put it in the chat window, and we'll be sharing that with everyone as well. I'd like to go now to Boma Otobo. Boma is from Nigeria, and given the size of the Nigerian delegation in this movement for IA 2030, Boma, not to put too much pressure on you, but I believe in a way you are right now the voice of Nigerians in this movement. What has changed for you? What would you like to say? And please don't forget to introduce yourself, of course.
Okay, thank you, Reda, and thank you, Charlotte, for so much support from you guys all the time. Well, my name is Boma Otobo. I work with the National Primary Healthcare Development Agency. I'm the Deputy Program Manager in charge of service delivery. And for me, after 1 week of this movement, I was able to read through some of the ideas from the ideas engine. So beautiful. Some of these ideas are actually helping me to improve my work. And I believe before the end of this course, I would have gone through quite a lot of the ideas. Well, I see this as an interesting movement because if you really want to reach the unreached, you can do this by listening to what's happening in other countries, how they were able to resolve some of their challenges, and being able to get to those who actually are not able to access the services. So I believe that with what we're getting from this platform, if we can implement them, I'm sure we will be contributing our own little quarter from our own space, and I'm sure things will improve in no time. So glad to be here. I've had very made friends, so to say, and also the technical sessions have also been very enlightening. I've learned quite a lot, and I'm always happy to also share my experience with others. Thank you. Over.
Thank you very much, Boma. I have to ask you this before I ask you to unmute again. What is your message to your fellow Nigerians? You are the largest group from a country, and that confers a special responsibility. You are the largest group starting out. What is required for you to be the largest group of people who successfully complete the successive peer learning exercises and who change these ideas into practice, into actions, into results, and ultimately impact?
Yes, so Reda, I'm not surprised that Nigeria is the largest group. We have a lot of people who are interested in making a change. So I'm really not surprised. And I would even want to canvass for more healthcare workers to also join this movement. So for us, we want to show that even with the little or no resources that we get, we also will be able to deliver on our targets. So for the Nigerian group, I just have to encourage everyone. I know it's not easy. We are faced with a lot of challenges in the health space, inadequate funding. We have challenges with insecurity. We have challenges with banditry and so on and so forth. However, we're not deterred. We're still aiming to be the best. And I can assure you that even before this is over, many more Nigerians will get on board because we need to make the change. Nigeria will lead and other countries will follow. Thank you. That's a promise we make.
All right, that's great, Boma. Thank you so much, Boma. Now, let's hear one more person while Charlotte figures out who has the microphone ready to go. I just want to show you there's actually a lot happening in Telegram as well. So you can see here another wonderful message from Professor Becky Tagbo. And then we like it when there's love. What I want to show you though, before we go to our next speaker, is just over here. You see in the you see where my cursor is, the little arrow, right at the bottom right here. So if you do not get to speak today, some of you might be frustrated. So what you can do is just go to Telegram and record your message. So hello everybody. I am going to invite you to share your testimonial, answer the questions especially if you were frustrated because you had your hand up and we did not come to you. So I'm just sending out this message to everybody, and know that you too can record an audio message. So you don't have to type everything out if that's tedious or difficult for you. Just record yourself and introduce yourself. Don't forget to tell us who you are and what you do. And then tell us, for example, what did you get out of the experience sharing this week? That's what we want to know. Okay, and you can see my message has just appeared here. So you can do the same. This is just an invitation to let you know that there are many, many ways of sharing experience. And in fact, we want to talk about the experience sharing session. So this is every Tuesday and Thursday with François Gass and Charlotte Mbou. So I don't know if Syed is here. No, he's not. But Charlotte, could you tell us? So Syed shared 3 ideas in the Ideas Engine. He also joined the experience sharing session. What was the topic? What did you discuss? And what's the key takeaway that could be of interest to everyone here?
Okay, thank you, Reda. So Syed from Afghanistan shared with us during the Thursday's experience sharing session on the measles outbreak response based on the current surveillance of measles cases and outbreak detection in their country, Afghanistan. So they are planning to carry out a response, an outbreak response, with the intention of reaching 1.3 million children from 9 to 59 months in 59 districts of that country. And their strategies are to 35% of the target population will be reached through fixed vaccination sites, and more than 60% will be reached through mobile and outreach section. The key takeaway from Syed's idea was that micro planning is the key to actually succeeding a vaccination campaign against measles. But beyond micro planning, there is the implementation itself, because micro planning can just contribute a little part, but implementation is very important, and that timely execution of planned activities is also very capital for the success of their campaign.
Thanks, Charlotte. So we can see what's on the slide. What you are an immunization professional. What do you get from a session like this, discussing Syed's challenge and working with François Gass and everyone else in the room to actually help think through this challenge?
The issue is right now, many countries are actually, including mine, they're facing measles outbreaks every year, and there can be measles, yellow fever as well, in some cases even cholera outbreaks. And from this, you're able to learn from this experience how the strategies that are putting in place. Most often we focus on fixed strategies. That's 70% fixed strategies, 30% outreach. But in this case, they instead reverse the situation. So it's more of outreach and mobile sessions in order to reach those populations that are hard to reach, and then instead of focusing on the fix, that is sitting at the health facilities or in certain areas to wait for the people to come with their children. So I think that is one thing that's very important and particular from this particular experience.
What I'd like to say is you don't want to miss these sessions. This is Tuesday and Thursday. If you can't be there at the time when they take place, you can watch the recordings. I want to ask François Gass, who together with Charlotte, so they facilitate these sessions, but these sessions are about you. Something like Syed's idea practice about measles outbreak response. What did you learn, François? And why do you think these sessions are worth attending?
Thank you, Reda, and thank you, Syed, for sharing your experience. And I think Syed does, to my opinion, that's highlight the first thing I do realize when you have a challenge, that very often the challenge is the outreach session. And that maybe there's not been enough focus on executing outreach that will lead to the results that you expect. And I think Syed has highlighted that you need the detailed micro planning, especially for the outreach. And I think what he highlighted also was the fact that you need to mobilize the decision makers, otherwise your outreach may lose its impact. And he has identified key decision makers that will make sure that the population is there when it comes with outreach. So I think the last point, which of course goes to an idea is an idea, a plan is a plan. We all know many plans that have never come to life, but this time is focusing on the quality and the monitoring of execution, which is maybe a top priority to make sure you have the success you expect. Over to you, Rita.
Thank you, Francois. Now, this was one of the challenges, one of the situations discussed in last week's experience sharing. There are new sessions happening this week. You really don't want to miss these. At least go and watch the recording. So we have Samuel Malogaye Badiekang from Ghana, who works at the regional level. Samuel is actually in the room with us today. So I want to ask you, Samuel, we can see your challenge on screen, so there's no need to tell us again what it is. Low COVID vaccine uptake, and you developed a research proposal to determine the reasons, and you had some important key takeaways. But what for you, why did you attend this experience sharing session last week, and what did you get out of it? That's what we're interested in here, so others can make that decision, should they attend or not.
Okay, yeah, I must say the experience, okay, let me introduce myself first. I'm Samuel Maluga Badiekang. I'm from Ghana, and I work at one of the newly created regions in Ghana. Actually, the experience sharing sessions are very vital, because when you attend them, you get to listen to other people's challenges, which you can also adapt to your situation to be able to help you refine your strategies to improve upon whatever work that you are doing, which helps to improve immunization coverages, and then to ensure that children are protected from vaccine preventable diseases. So for me, apart from this, from previous meetings that we've been having, it actually gave me a sense of direction. The protocol that we developed, it helped us also look at the integration of vaccine hesitancy into the protocol as a way that we can also look at how people, why people usually will be hesitant at taking vaccines, which are very efficacious in the management or in the prevention of vaccine preventable diseases. So that's one of the things that I see. And then apart from that, last week, as I also joined, you also realize that you are not alone. Whatever challenge that you face, as much as you share, it also helps you, it helps the wider community who have interest in your situation be able to help you out with an idea or with a coaching or a guiding as to what to do to ensure that whichever challenge that you are facing, you will be able to overcome it. So I think the last time that I joined, it was really very insightful. It makes you not to feel like you're alone, but you know that other people have interest in the work that you are currently doing and are willing to support you to overcome your challenge.
Thank you very much, Samuel, for sharing why it's worth attending an experience sharing session. And again, if you're not convinced, don't come. These are not sessions for everyone. These are for people who want to share their experience and help their colleagues problem solve their problems, tackle their problems. This is the kind of experience that we want to share. So for example, here, I just want to pull up this example. Mohammed Wazir Siddiqui, who's watching us on Facebook, he says, in Afghanistan, fixed outreach and mobile activities are there, but still there are remote areas not covered properly. So what we'd like to hear, Mohammed, we hope, Wazir Siddiqui, we hope you'll come to tomorrow's experience sharing session with us so you can share what does work in Afghanistan. We may think, rather than focusing on the positive, focusing on what you've been able to do in very challenging circumstances. Now, I think we have 2 questions here up on the screen. So I'm again going to lower all of the attendees' hands. Again, we have a mechanism. If you are frustrated because you haven't been able to share, just go to the Telegram and click on the little microphone where you see the arrow, the mouse cursor here. Click there and you can record yourself and share your story. But for now, would like to ask for volunteers to answer these 2 questions. What is the idea or practice you shared or will share? And maybe we should focus on the second one. What ideas are you looking for to help you with your challenge? So don't forget to introduce yourself. I see one person who has his device name A606658. So let's go to A606658. We'll at least be able to see, to understand who it is. And there's 555 people in the room. I saw the counter going up beyond above 600. This is just amazing. I think we should, if we didn't have already, we're diving into the substance, into what matters for immunization professionals. So we're not going to do the applause, but A606658, please tell us who you are, where you work, and then you see the two questions on screen for you.
Hello everyone, I'm Dr. Ahmed Naama from Iraq, Baghdad. I'm working as a health field officer with the International Committee of Red Cross. So, due to the COVID campaign, there was a national COVID campaign in Iraq that's supported by the ICRC for COVID immunization. That was last year, but it has some negative feedback because people start linking between the COVID vaccination and routine immunization system or program. So, and that led to a high number of defaulters and a drop down in the coverage rate. This year we are working on a defaulter tracking program and focusing on the rural area. We started with outreach activities and health promotion, but that lead a little increase in the coverage rate because most of the people are not accepting the idea of health promotion, or also due to the COVID pandemic and social distancing, it was of little benefit. So we started on a new program of calling the defaulters by phone, because most of the families, when they registered for an EBI program or immunization program, they leave the family phone in the BSCC. So we focused on several BSCCs in the rural areas that has the high number of defaulters and trying to tracking them by phone, and it's kind of health promotion individually. We also provide an on-job trainings for the staff working for the MOH, especially for the EBI staff. So how can they explain the idea, the benefits of the immunization system, and how it works finally. The main idea we found out in the population that people are not aware enough of the immunization program and what's the benefit or the impact of immunization, especially when there is like a negative feedback on media or in the population about vaccination, and people start linking between COVID and the vaccination, and there is the hesitancy and fear of visiting the health facilities.
Understood.
What idea yeah.
Yes, go ahead.
What ideas I'm looking for to help me? First, the first week of the movement was like a huge impact on me. So I'm not, as you mentioned, I'm not suffering alone. So there is an immunization hesitancy in all over the world, and also it's a bad news for the whole world, but it was good for us because we are not alone. We'll work all together. The ideas I'm looking for, and it's about the main challenge I'm facing, is the commitment of the health staff themselves. Because we have like 10 health sector, each health sector have 10 BSCCs, and each BSCC there's like a specific EBI team, and we have to hold them all committed to the program and with the positive attitude, because they are in direct contact with the families and with the beneficiaries. So this is the main challenge I'm facing, and I'm looking forward from all the colleagues all over the world to help me with that. Thank you.
All right, wonderful, fascinating, and thank you for joining us from Baghdad, Iraq. Will you be able to join the experience sharing session tomorrow?
Yeah, sure. I'm also joined the country group on Telegram, but it seems I'm the only one there. So I'm joining tomorrow. For
All
this
right.
session.
And you're not the only one to be the sole representative from a country or working in a country if you're in the context of an ICRC delegation, but that makes your participation even more special. Now, to get more to the point, so what I heard is your challenge is your staff motivation or staff engagement. So if I go to the ideas engine right now and I type the word motivation, let's see if anyone has shared ideas or practices that might be relevant here. And here I can see here that there are indeed, here is one training of vaccinators, an increase in incentive of motivators for each session. So this is an idea from India. And we're not going to go look here, but you can see there are quite a few. Let's see how, I'll just scroll down. Yeah, there are all of these ideas.
Exactly, Rida. Exactly. We started with the on-job training and holding session for the staff. But as of one of the ICRC mandate is not to make a substitution of the national program. So we can't provide incentives, but we can provide like on-job trainings, holding sessions, and even like visiting all the BSCC and getting to work together.
Okay, fascinating. Well, keep us up to date. Update us on when you find an idea or practice that is useful to you. We want to know. Now, there is a deadline as we are moving to closing the assembly for today to submit your idea or practice in the ideas engine, and that is Friday evening. So make sure, for those of you who are still catching up, I'm just going to share a couple of tips. First of all, there are two methods to join the ideas engine. One is you've received an email. You can see what this email looks like on the right hand side, and it's actually the link, the blue link, Immunization Agenda 2030. That's where you need to click. How do you find this email? Search for the word Wazoku, Wazoku. Every platform has its little quirks. This is one of them. It's a wonderful platform for sharing ideas. Getting there is a little bit difficult. So the second key to get to the ideas engine, this is method number 2, is to actually go to create your account directly from the platform. So we did not open this up initially, but I'm going to share the link here for anyone who's still having problems. This is to try to make it easier for you to join the platform, no matter how far you got. So let me just. There is a tutorial specifically for that as well. And if you have seen this, then you've successfully joined the engine. Now, what you need to do is look at the different strategic priorities, choose the one where the idea you want to share goes, and then click on Add Idea. And then fill in, of course, you still have to answer the questions. Now, we're 6 minutes away from the end of this assembly. But remember, there are activities throughout the week. Only join them if you feel they can help you. All right, at least give it a try once, but then you can determine, did this help me? Was this worth my time? You are the only ones who can answer that question. There is no activity in the movement, in the full learning cycle, that you just have to be there for its own sake. Everything is there to help you in your work. Now, the next exciting and actually fun activity is the Immunization Agenda 2030 Twins. So, Charlotte, what are the IA 2030 Twins? What exactly is going to happen right after this assembly is over? What will we be sending out? How can this make a difference for participants?
Okay, thank you, Reda. You're going to be receiving a mail that is pairing you up with another scholar of the IA 2030 movement. That person is going to be your twin throughout this full learning cycle. That is your go-to person to share experience, to share challenge, to share good news, whatever you may be going through, and you can use whatever medium to communicate with them. So just be on the lookout to receive a mail from us that is matching you. And once you are connected, since we are going to be focusing this week on the ideas engine, is first and foremost discuss on an idea or practice that you have shared or you plan to share as far as the ideas engine is concerned.
So Charlotte, some alumni have done remote coffees before. What is different this time? How is your twin different from just having a coffee with someone?
Yeah, so in the past, the remote coffee was just an instant, maybe 5 to 15 meeting, virtual meeting, of course. And afterwards, you were not required to reconnect. But what is different this time around is that you are tied together. I'm almost wanting to think that you are Siamese, digital Siamese twins, because you are joined together throughout the full learning cycle. So it's not just a one meeting or a two-time meeting. It's you constantly be checking on one another throughout the full learning cycle.
All right, that's yes. So once you find your twin, now if it doesn't work out, the person doesn't respond, don't panic. We'll be doing another round of this, and there's actually, you're going to be trying to reach one person, another person is going to try to reach you. Now, if you need help with the Ideas Engine, even with the twins, join the technical support. That's on Wednesday at 4:30 p.m. Wednesday and Friday. So Wednesday is the next one. Now, I want to finish. We only have 3 minutes. So I'm going to tell you what comes next. The Ideas Engine was step one. But as François Gass said earlier, having ideas is just step one. What really matters is then taking those ideas, turning them into action, turning those actions into results, and turning those results into documented impact. So as you can see, if you remember, you probably saw this calendar and wondered, well, what are all these different components? So on Monday, the 21st of March, we'll be kicking off situation analysis. And what is this? So you can see here, this is the calendar. You will be analyzing. So first of all, it's about you and your challenge. This is not a theoretical or academic exercise. We'll be asking you to look at your situation with respect to your challenge. So if your challenge, and be as specific as you can, if your challenge is that you know that there are children living in a remote area who have never been vaccinated, well, in order to take on that challenge, before you start taking actions, doing things to reach those children, we believe it is important for you to analyze what exactly is the situation. Where are those remote areas? What are the access issues? What is happening? What is the root cause in a way? I'd like to turn to François Gass to tell us, why is it important before you take action to analyze your situation, François?
Thank you, Reda, but I'm sure that people understand that if you want to be, you don't have much time, you don't have much resources, you have limited human resources, even cash availability. So you need to focus to make a difference. And to focus, you need to understand why you have this challenge and what are the main root cause, and try to identify the priority root cause if you have many, because some cause may be 5% of the problem, others 50% of the problem. And this will help you to define a solution, an idea that you execute and will make a difference. Even if it does not make all the difference, importance will become to focus, monitor that you execute your idea, and as Reda said, that you have an impact on the problem you try to solve. So the analysis and the root cause is very important, not to waste your time and your efforts and your resources in making so many things that may not have a little more impact on your problem. Over to you, Reda.
Thank you very much, François. So this is a 4-week process that we will be kicking off on Monday. Now, again, you want to think, is this for me? Do you want to look at your situation to make sure that the actions you take make sense, that they will actually be attacking the root causes of the problem? No one can make that decision for you. You will remain a full-fledged member of the movement, even if you say, I don't need to analyze my situation. I think I already know everything I need to know to take my actions. Or if you say, I don't have time to do additional situation analysis, I'm having trouble keeping up just with my daily job. Whatever your answer, you need to make the decision, yes, I will go for situation analysis, or no, I will sit this one out. And of course, you know what I'm going to ask next. If you're going to participate in situation analysis, if you're starting on Monday, the 21st of March, there's still 520 people in the room. Go ahead and type yes in order to confirm your commitment. Yes or go. You can also type the word go, because you will be using the ideas to better understand your situation, to think through what actions you're going to take, but really to focus. All right, and I wish again I could show you all the goes and yeses that are showing up in the chat. And if you're one of the no's, if you're not going to be part of this, I'm sorry, because you're going to miss something, but you probably have good reasons. It has to come from you. This is a movement. A movement does not work by decree or prescription. It works because people want to improve immunization. All right, and we have Eddie G. getting senior. Let me see if I can show, if I can try sharing my, sharing the screen of the Zoom chat window. So let me see. Yeah, I think I should be able to. Let me see if I can make it a little bit a different size. Okay, so now everyone can see the yeses and can see the names that are being shown here. So please go ahead. All right, Abdul Latif, Charles Mwangi, Ayobura, Sendema, Fausta, Michael, Dr. Bala, Mohammed Naman Khan, Mohammed, Dr. Ayek Busi. I'm having trouble keeping with the names, but it sounds like it feels like there's a lot of commitment. There is a lot of will to go beyond the ideas, to go to the next stage of the movement, which is about analyzing your situation as you think through the actions you are going to take. Think through why you want to take action, what actions are likely to give you the result that you want or that you need. That is what we'll be starting on Monday. But already on Friday, you'll be able to check your personal learning space and find the 2 key documents. Thank you, Miafo's voice, who says, yes, I will be there. Wakar Ahmad Sumru, who says, I will be there. Chepilat, the same. So this is coming in from social media. Now, remember, if you need help, there's still some of us who need help, and that is fine. We will not leave you behind. If you need help to access your personal learning space, remember that you have sessions, as we keep saying, don't suffer in silence. Here are your next steps. So you can see here, starting today, you're going to receive Watch Your Inbox. The messages are not being sent out yet, but they will be within a few minutes. Have your remote coffee and find your matching twin, perhaps, for the movement. Someone you can stay in touch with that can support you. You can support them. That's what we'll be doing. You can also subscribe to the calendar. There's a lot going on, so you can. One of the best ways is to stick with the calendar. And I think that is it for today. What an amazing session. Thank you so much. Wonderful to be with you. Again, Monday is about the inspiration. Monday is about inspiring each other, hearing each other's voices, knowing that there are people all over the world who are committed to improving immunization. That's it for today. Thank you. We are 43,790 strong. Atahir Abubakar from Nigeria, glad that you are with us. It is not only the connections we make with you, it's the connections you make with each other. This is part of the full learning cycle. More than 6,300 immunization professionals are participating in just the first few days alone. More than 300 ideas and practices shared across the network. Once again, thank you and take care. And remember, unique opportunity to share tomorrow. If you haven't signed up yet, please join us tomorrow. You won't, you think about it. If you decide to come, don't miss it. I think that's the important message. You first need to make that decision. This is worth doing. Thank you and take care. And for Leonard, the recording is available already on our YouTube channel. So just go to YouTube. You'll find it. It's there right away. You don't have to wait. You don't have to ask for it. You can find it on the YouTube channel. Thank you, Raouf Majid. Bye-bye.